Anxiety disorders are a category of mental disorders characterized by feelings of anxiety and fear, where anxiety is a worry about the future events and fear is a reaction to current events. These feelings may cause physical symptoms such as a racing heart and shakiness. Generalized anxiety disorder, or GAD, is not fully known how or when a person will develop it. The GAD is known to run in families, but not usual in most cases. The GAD is found in several parts of the brain that are involved with fear and anxiety. People will not be put at risk for this illness. The worst that will happen are headaches and insomnia. Many GAD people have excessively worried about everyday things for at least 6 months. The second disorder is panic disorder. The panic disorder is not known how or why people have it, but is found in several parts of the brain where it has been involved with fear and anxiety. This psychiatric disorder frequently rises the anxiety and the fear, which can cause you to faint or to panic. Many ways of increasing the risk of panic attacks are traumatic events, major changes in your life, or major stress. The third disorder is called social phobia. It's the extreme fear of being scrutinized and or judged by other people in social situations. About 15 million Americans have this disorder. The earliest age you can develop disorder is a staggering 13 years of age. A huge 36% of people who report symptoms are 10 or more years before seeking professional help. Many people think that this will make them look weak in front of others, so they keep it to themselves. This can interfere significantly with daily routines, occupational performances, or social life, making it difficult to complete school, interview and get a job, or have friendships and romantic relationships. The fourth and final disorder is about phobias. A phobia is an unrealistic or exaggerated fear of a specific object, activity, or situation that in reality represents little to no danger. Common phobias include fear of animals, such as snakes and spiders, fear of flying, fear of heights, and in some severe cases of phobia is stage fright. In stage fright, you might go to extreme lengths to avoid this. Unfortunately, avoiding stage fright will just strengthen the phobia. The symptoms. How would you know you were suffering from this illness? The first disorder, the GAD, can't seem to get rid of their concerns, even though they usually realize that their anxiety is more intense than the situation warrants. Physically, the symptoms that often accompany the anxiety include fatigue, headache, difficult swallowing, trembling, irritability, sweating, nausea, lightheadedness, having to go to the bathroom frequently, feeling out of breath, and hot flashes. They can't relax, they startle easily, and they have difficulty concentrating. Often, they have trouble falling asleep or staying asleep. The prevention for this disorder is medication or psychotherapy. The second disorder is panic disorder, and they experience frequent, unexpected panic attacks that aren't tied to a specific situation. They worry a lot about having other panic attacks and are behaving differently because of the panic attacks, such as avoiding places you've previously had panic attacks. The prevention is a cognitive behavioral therapy, exposure therapy for panic attacks and panic disorder. Social anxiety disorder is an intense anxiety in social situations. Avoidance of social situations, physical symptoms of anxiety, including confusion, pounding heart, sweating, shaking, blushing, muscle tension, upset stomach, and diarrhea. Some children with this disorder may express their anxiety by crying, clinging to a parent, or throwing a temper tantrum. The prevention for this, unfortunately, there's none. Social anxiety disorder cannot be prevented, but seeking help as soon as symptoms surface can make treatment more effective. And the last one, phobias. A specific phobia involves an irrational, persistent fear of specific objects or situation that's out of proportion of the actual risk. This includes the fear of situations as nature, animals or insects, blood, injection or injury, or other phobias. There are not many other types of specific phobias, It's not usual to experience phobias about more than one object or situation. The best prevention is go to your doctor and seek a therapist. So, the myths and facts of GAD, or generalized anxiety disorder: it cannot be cured, and the myth is face your fears and get into situations where stress is at high levels. This is false. This will make you even more scared of your fear. Panic disorder: it cannot be cured but merely reduced. If you have a panic attack, you will pass out. False. You will not pass out. Your blood pressure will rise slightly, in which will not make you pass out. Social phobia cannot be cured. Always carry a paper bag in case you hyperventilate. Paper bags are the crutches of anxiety and keeps you anxious when you're not supposed to be anxious. Phobias cannot be cured also. A never-ending supply of compassionate and reassurance from your friends and family will help you get through the disorder. This will make you feel demoralized and not at your full emotional health.